Dr. Amy Jordan with Bear Creek Mobile Veterinary Services. I am Frankie the Foal's veterinarian. We are in the process of trying to heal Frankie, and in this fight we have attracted a little bit of attention with Frankie's story, and doing so has brought about a few people that have had some questions, and we would like to take a moment to give you guys an update straight from us about how Frankie's doing, a little bit about what Frankie's day is like, plus address some specific questions that have come about from Frankie's celebrity status. Her owners and I have spoken this evening, and they know what you're about to know. Frankie is doing fairly well. I'm very pleased with Frankie's progress as of today. We've had some concerns about her blood work. We finally got a little bit of a break and some good news that she is stabilizing and her blood work is starting to look better. It's not normal yet, but it's improving. Her wounds are healing, some of which are opening up, and we may have to go back in later and close them or allow them to heal on their own. We are keeping a very close eye on Frankie. She's nursing from her mom now. Lily is doing much better. We had some problems with Lily in the past, but Lily is pretty much normal, diligently watching over Frankie. We still have people sleeping with her through the night, making sure that she's doing okay and that she eats. We do feed her from a bucket still, even though she's nursing some from mom. Her owners are spending more time with her, visiting, and even helping with some of the volunteer shifts. One of the main questions that people have asked about little Frankie is whether or not she'll be normal when this is all said and done. She does have currently some facial paralysis on her right side. To be honest, I can't tell you if this is going to be permanent yet. The swelling is coming down. She uses her tongue more and more every day. She still has a slight twist to her lips, and her muzzle is not quite symmetrical, but it doesn't keep her from eating. It doesn't keep her from drinking. It's not going to inhibit her in any way from being ridden. I've had patients in the past with similar problems, even as adults, and they do quite fine. So the paralysis is actually not a main concern, at least not in terms of her abilities. She is emotionally, personally, with her personality, a very normal foal. To be around her, you will know when she's upset, you'll know when she's hungry, you'll know when she's happy, when she's tired. She is very strong in her personality. She's a very strong, strength-wise, a very strong foal. She is very opinionated in her ways of letting us know what she likes and what she doesn't like. Another question that has been brought to us is, where was mom in all of this? Did mom not try to save her? Well, the truth about Lily is that Lily is only about 4.5 years old herself. This was Lily's first baby, and it wasn't exactly an intentional pregnancy. So we've got a little bit of a situation where Mama is very new at this. The dogs ran Mama quite a bit, and Lily suffered quite a few problems of her own from it. But no bites, no scratches, because the dogs never got to her. They went after Frankie. Frankie could not defend herself, and Mom was too scared, too panicked to think rationally and do what needed to be done to save her foal. Unfortunately, that's the truth. It doesn't always happen that moms are good moms, and moms always know what to do the first time around. But she's very concerned about Frankie, and she doesn't want anything to happen to Frankie now, so she watches over her closely. Lily is back to normal in terms of her health, and sees to Frankie's care. She's producing milk that she quite readily lets Frankie drink. All in all, they're both a well-matched pair. They're doing very well. The path is clear for Frankie to go home. This should not happen again. The owners are seeing to it that all is well for them to come home, and are very ready for Frankie and Lily to both come home when it's time. Let me ask Jordan, are there any other questions yet that I've not addressed?
How are the contributions that we're getting from all the donations, how are they being used right now?
Okay, we have, as you guys have probably heard and seen, we have quite a few people wanting to send in donations to help with Frankie's care. The owners and Frankie and myself all very appreciative of anything and everything that people are doing to reach out and help Frankie and her owners. We see to her care. We have, during a daily basis, she has a lot of things that she has to undergo. Antibiotics currently still, anti-inflammatories for pain and inflammation. She also gets daily cleaning of all of her wounds, scrubbing, application of topical treatments. Blood work is done on her every other day to make sure that she's headed in the right direction and that we're doing what we need to do for Frankie. Occasionally Frankie has had to do some surgical procedures to help correct some problems. We also will have a few additional surgeries that still have yet to be done to see to it that Frankie can go home and be as healthy and happy, pain-free, and normal as possible. There's still a lot that needs to be done. Things that are donated, supplies, since people have not wanted to just donate money, they've donated supplies, and that's wonderful too. Those supplies are being utilized to the best of our ability. Those supplies are obviously not being charged to the owner. Those are donations that don't go on Frankie's bill, and that helps keep the costs down for her owners. As of right now, we haven't fully collected all the PayPal accounts yet, but once we do, the bill will be mostly covered as of today. But there's about 2 more weeks of therapy and potential surgeries left to go before Frankie can go home. So we can't stop in terms of her care. Her care will continue for at least another 2 weeks. But we do appreciate all the things that have been donated, and of course the financial support that goes to her care, her hospitalization, her blood work, her antibiotics, surgeries, things like that. Any other questions, Jordan?
I think it would be a good thing to end on, but let us know about Team Frankie, and what does Team Frankie do every day? The core Team Frankie, what do they do? What is their job?
The core of Team Frankie is made up of Bear Creek Mobile Veterinary Services staff, myself included. We set up a treatment plan for Frankie. It changes on an almost daily basis. We have staff members that see to the medications to make sure that they're given on a timely manner. Vigilantly watch over her to make sure that her wound stays clean as possible, to make sure that she gets fed as frequently as she needs to be fed. Initially, in the first week, it was every hour. Now it's every 3 hours. By the end of another week, I would really like to have it so that she gets fed from a bucket at a set 4 times a day. As of right now, someone is with her 24 hours a day, and will continue until we feel like she can be left alone. We, once daily, take her to our wash stall, literally scrub every square inch of this little baby to make sure it's clean and disinfected and that the wounds have the utmost chance of healing. We apply topical treatments to her. We, again, pull blood. We lose a lot of sleep. We give up a lot of sleep. All of Team Frankie's lives have been basically put on hold to make sure that she has the utmost care and has the best chance of going home.
the volunteers for Team Frankie that are coming in that aren't staff, what do the volunteers do? How are they helping out? How many do you have?
Volunteers sit with Frankie and see to the non-medical care, the TLC side of care, making sure she gets to eat on time, making sure that we keep the flies at bay, making sure that mom has water, that the stall gets picked, writing down comments, when does she go to the bathroom, how much did she eat, things like that. The staff is the only members of the team that are allowed to actually medicate Frankie. That's just mainly because of training and from a medical standpoint, we have to make sure that everything is correctly followed. But the volunteers allow us to get some sleep and continue our practice and continue to help other animals that need help on a daily basis. We have a full large animal practice that we still have to maintain. I still have thousands of patients that need me on a daily basis, not just Frankie. She is very important to us, but so are all of our pets and all of our clients. So the volunteers allow the staff members and myself to get a little sleep and not have to work all day and stay up all night, 7 days a week. They're very much appreciated.
I think that's it.
Anything else?
Well, let me just close and say that a lot of us still ask ourselves why. Why did we do it? Why did we decide to save this little foal? The owners and I talked about this just the other day, and from a distance, it's easy to look at pictures and say that you shouldn't have done that. Why? You should have just put her to sleep. That would have been the easy thing to do. It may have been the right thing to do for some. But when you meet Frankie and you spend time with Frankie, you know that there is a foal inside there with the strength and the desire to live and to fight. And we do this for Frankie.